Event here, but I appreciate you guys coming out and bringing your signs. My name is Lindsay. I'm one of the leadership and organizers with Miami County Indivisible. We also have Springfield Indivisible with us, who are represented by Warren Davidson, Congressman Warren Davidson. He is the congressman for the district, so he covers Clark County, Miami County, Preble. I believe he also covers parts of Mercer. And he goes all the way down to Butler. Yes, we actually have a sister Indivisible group that's holding a similar rally today as well, same time and everything, in Hamilton. But basically what I just wanted to say is that I'm sure everybody's aware, as you're here, that on Thursday, the House's bill, the House's American Health Care Act, passed through the House of Representatives from a vote of 217 to 213. One of those votes was Congressman Warren Davidson, that supposedly represents us. He represents our district and a bunch of other people, like I said, through all of those counties. And then, of course, I'm not sure if you guys have been paying attention. I'm sure you are, as individuals who are aware of what's going on. A bunch of those yes votes were from congressmen who admitted on TV that they had not read the bill. They maybe skimmed the details, or they'd had their staff read it, and they might have talked to their staff in regards to what the actual details of the bill were. This bill also has not been passed through or analyzed by the Congressional Budget Office, so we don't know really how much it's going to cost us. We have an idea because of the previous bill and a lot of the similarities from the previous bill that was not even brought forward to a vote in the House, but we don't have that analysis stating overall what the impact is going to be, which is very scary. Per Paul Ryan himself, a bill should not be passed through the House, especially one on health care, that has not been analyzed by the CBO, that has not been told what we're going to actually have, what the cost to us is going to be. If you've ever heard Congressman Davidson speak, frequently he talks about compassion. He talks about that being a big driving force on why he votes for certain things and how he develops legislation and so forth. And so I think I'm concerned about maybe that he doesn't know what that word means, or it doesn't mean what he thinks it means. Because
also, he said on his Facebook page that he hasn't given the date, but he's going to have a live presentation on his Facebook page sometime in the near future.
Which is interesting that they would do that now and not, prior to putting the bill, voting it through the House.
Why doesn't he do it in person?
Exactly. And why doesn't he do it in person? He had a town hall here, held by a group that supports him and is very pro-Davidson, and he was not willing to take questions at that group, really. He was not really willing to take a dialogue and really speak to his constituents, all of his constituents. So because the health care bill that he voted for, without having this analysis, without having representatives being even willing to read it, I'm going to kind of read a couple of things that this bill is actually proposed to do. So states can get waivers to charge more for pre-existing conditions. So while, yes, there is something in that bill that states that it will cover pre-existing conditions, if you cannot afford to pay for your medical insurance, then it's essentially the same thing as not covering pre-existing conditions. I have a thyroid condition. If I can afford to buy my medication, then I'm essentially, or if I am charged so much that I can't afford to get medical insurance in the first place, then that bill is not going to cover me. It's not going to cover anybody with any pre-existing condition.
Right. Exactly.
So states can also opt out of rules that require them to pay for basic services. So any healthcare insurance plan that you have might not pay for emergency room visits, might not pay for hospitalizations, might not pay for certain medications. All of these very basic things that we need as individuals who are not always healthy and don't deserve to just not have health insurance because we're not healthy. Mental health coverage and substance abuse treatment will be drastically cut. Obviously, if you live in the Miami Valley, we know for a fact that we've had a huge issue with the opioid crisis. We have people dying every single day because they have an issue and they can't get treatment, either for substance abuse treatment or mental health treatment and so forth. That is going to have a drastic impact specifically on our district.
not just the drug users that are impacted by that disease.
It's families.
It's the community. It's businesses. Yes, it's families.
Yes.
It's the entire.
It's children. It's everybody who has to, is really going to be impacted by not being able, by somebody they love not being able to get treatment. Also, elderly people will be charged more for their health insurance purely based on their age. So somebody who is a healthy young person will be charged a lot less for health insurance, of course, if they don't have a pre-existing condition, than say an older person who has an issue or no issue at all, who has no pre-existing condition. They are still going to be charged more just because of their age.
It's not that old, it's 45.
Right.
That's why I said me.
Exactly.
Is there any cap on how much more they can? Because they were saying like up to 5 times as much. Or...
I think that they were estimating that, but we don't know for sure because we don't have that analysis that we need. Exactly. Large companies will no longer be required to offer health insurance to their employees. What is considered large companies? We don't know. We don't have these details. We don't know what companies will continue to be required to provide health insurance to their employees and which ones won't. So you're going to have a lot of people dropped from insurance who have a job. Then Medicaid, which serves millions of people who have disabilities or are low income, as well as our veterans, is going to get slashed by up to $900 billion.
That's my mother.
I say, if you have anybody who's on disability, I think at this point, I think that they were saying something in regards to like at least 3 million veterans in this country will no longer have health care because of the Medicaid slash.
Warren Davidson himself, who is a veteran, said that veterans are moochers. That's what
Interesting. Well,
And many veterans are moochers. It
well,
turns
and
out
according to I think I'm not sure what his last name is, but there's a congressman who is in the Freedom Caucus stated that people with pre-existing conditions don't live good lives, so they shouldn't have health insurance anyway.
That's why they have pre-existing conditions.
Mind you, Warren Davidson is in the Freedom Caucus with this certain congressman. He's also in the Freedom Caucus with the congressman that said yesterday that nobody dies from not having health care.
They also said if people would start going to church, this was our vice president, that they wouldn't be so sick anymore because there would be some healing from going to church.
Oh, Lindsay, can I point out too that the cuts in Medicaid are proposed to be $880 billion?
Yes.
The tax cuts that are in this bill to the wealthy are also $880 billion.
Yeah, isn't that a coincidence?
Yeah.
So the only people that are going to benefit from this plan are rich people and healthy people until they get sick.
Yes.
Young, healthy people until they get sick.
Ohio's Medicaid is going to be frozen in 2019.
Let's say Ohio's Medicaid program will be decimated. So we have, I'm going to ask this question, like, does that sound compassionate to you?
No.
Is that a bill that Warren Davidson should have signed, should have voted yes on the basis of a compassionate bill for the people of Ohio Congressional District 8?
No.
Thank you. But I'm not the expert, obviously. I don't know everything. Warren Davidson, while I'm sure he's skilled in a lot of areas, is also not an expert in this field. So let's turn to the experts. On my last couple of minutes, let's turn to the experts in regards to what they say about the Health Care Act, the American Health Care Act. So I have a list of the actual experts who oppose this Health Care Act. AARP, which if you called Warren Davidson's office, I spoke to a staffer specifically who told me I was wrong, that pre-existing conditions would be covered. Not only did they tell me that, they said that the AARP was spreading misinformation to millions of their people, of their constituents, and stating that they were covering pre-existing conditions. I questioned the staffer as to why or how one of the largest special interest groups in this country for the elderly would be lying and spreading misinformation about something like this. I'm sure that Warren Davidson knows a lot of things, and I'm sure his staffers are completely, up on a lot of the issues, but that did not sound like something that was misinformation to me in regards to what
would
the
they
AARP
benefit?
is saying.
How is the AARP going to benefit from lying?
Exactly.
And I may be stereotyping here, but a lot of members of AARP voted Republican.
I would imagine.
I would imagine that is true, which is unfortunate. But we also have the American Medical Association opposes this bill. The American Hospital Association opposes this bill. The Federation of American Hospitals, the American Cancer Society, the American Healthcare Association, America's Essential Hospitals, America's Hospitals and Healthcare Systems, American Public Health Association. The National Disability Rights Network opposes this bill. The National Partnership of Women and Family opposes this bill. The National Physicians Alliance, the National Council of the RAZA, the National Council to Preserve Social Security and Medicare, the National Center for Transgender Equality, the American Federation of Teachers, Planned Parenthood, and the Children's Defense Fund. And the list goes on. All of these expert organizations who know this field inside and out are stating this is a bad bill, that this does not serve our constituents. So we are here this afternoon to hold Congressman Warren Davidson accountable for a vote that he had not 1 ounce of compassion when he voted for, because that is not partisan. Because this is not a partisan issue at all. This is literally life or death for people. All people, regardless of race, religion, orientation, gender identity, everything. This is going to affect this entire country regardless of party. And that's something that I do not believe that Congressman Warren Davidson and many of the people who voted, if not all of the people who voted for this bill, understand.
Okay, guys, I want to thank you guys for all coming. Let's give Lindsay a round of applause. We all know the facts. Us around this circle know the facts. And the fact is, Warren Davidson doesn't show compassion. He wants to talk about economy, he wants to talk about economics, and it's just not there. The fact is, we're going to hurt under a variety of different things. The healthcare bill is not only going to hurt us, but then we have a tax plan that's going to just decimate our federal budget. But I want to talk a little bit about pre-existing conditions. So I've been hearing a lot from women Republican Congress people, and from a couple of congressmen who talk about how the bill doesn't exclude sexual assault victims. And that is just wrong. Yes, it does not say that rape victims are excluded from protection. However, the pre-existing conditions would include mental health issues such as PTSD, such as there's just so many things. There's STDs that won't be covered now. There's unwanted pregnancies that obviously I don't know anybody who would want to keep a rape baby. It just doesn't. It blows my mind how we are thinking that way. Then the other part of that is the physical assault part of that. People may have brain damage after this, pre-existing conditions, so they're not going to be able to get coverage, or they're going to get charged up to 5 times the amount that they would have been. So we have a couple things that we can fight him on, and we need to. We need to let him know that it's not compassionate to exclude pre-existing conditions, because those are our most vulnerable people. So I have a couple things I want to talk about. So Senator Bernie Sanders put out a great graphic, and I'm going to read off a list of nations who have universal health care. And I just want you to realize who's not on that list. Australia, Austria, Belgium, Canada, Chile, Czech Republic, Denmark, Finland, France, Germany, Greece, Hungary, Iceland, Israel, Italy, Japan, Luxembourg, Netherlands, New Zealand, Norway, Poland, Portugal, Slovenia, South Korea, Spain, Sweden, Switzerland, Turkey, United Kingdom. Who's missing from that list?
We are.
Exactly. What is the common thread among those people, those countries? They have been voted the happiest countries in the world. These people are just insanely taken care of and are so happy. And they're happy to pay higher taxes because their people are taken care of. Universal health coverage is not a privilege. It's a right. And we need to push forward to a single payer plan, because this is not going to work. What we have now, we know that ACA is failing in some ways and it needs to get better. But we also know that AHCA will decimate that program and will decimate healthcare in the United States. The idea of people not dying because they don't have health care just can't be true. It can't be. If they don't have health care, how are they going to get the essential medicines and the essential care that they need? I want to talk a little bit about format real quick. We're going to give each of you guys an opportunity to speak about someone that that is relying on ACA, or something that you disagree with on this bill. And then we're going to go off a list of pre-existing conditions that were in the past, the excluded from protection, and that we're protected under an ACA. Sherrod Brown put out a phenomenal list. But I just want to invite anybody who would like to speak at this point about the ACA and how it's helped you guys.
One thing I'd like to say is that the answer really is a single payer system. Because when you look at it, just today, the Hobart, former Hobart property down here has been sold to Kettering Hospital. So, okay, we've got Upper Valley, we've got Kettering. Now they're nonprofit, but what they have to do is they have to raise prices to pay for these new buildings. We have people like Express Scripts, which is also making profit on the drugs that we buy. You have Humana, for-profit hospitals that are making money and profits off of people's sickness. You have health insurance companies that are making profits. You take all these profits, and I don't care whether it's a Republican plan or whether it's a Democratic plan, healthcare is going to go up because you have all these profit-making entities that are involved in the healthcare. And until you get to a single-payer system, the federal Medicaid, the federal government cannot negotiate prices because a big pharma has lobbied that we cannot negotiate prices for Medicaid. This has to stop. We have some friends from Canada we talked to at church, at a forum. They are in love with their system. They live in Edmonton. They have the same type of a hospital that we have here. They live outside of Edmonton, a small town about 30,000, just like Troy. If they have a special need, they go to the University of Edmonton. They've got all the specialists like we have at Ohio State. So, the things you've heard about Canadian healthcare system being bad, it's not. It's very equal. They're very happy. She says she had breast cancer. When they came here to get healthcare, it cost them $18,000 a year, and it's Medicaid. They had to get a physical. It was non-invasive. They just took their temperature, they took their blood pressure. No Pap smear test, no prostate test, anything, for $18,000 a year. And why are we going around this big circle like this when a single payer, every industrialized country that you need, their economies are just as good as our economies. They're not wrecked. And every time I hear politicians say we can't wreck the economy, who's got to die then? If the economy is more important, if Japan can do it, Austria can do it, we can do it.
Sure, and thank you. One of the things that we hear often is that a single payer system is just our economy is not built for that. But so even and then we hear the response that a free market is what we need to go to. A free market. Well, that is all great. If healthcare systems and healthcare insurance and big pharma were subject to antitrust laws. The fact is United Healthcare owns like 40 some subsidiaries, who then they can roll how much each of those get charged for their premium. So what happens when they talk about how there's counties in West Virginia who only have one insurer? Well, that's probably because their mother company only allows one insurer to go in there because they own all the other ones that would. And so. So if we're going, there's two ways to do this: single payer or a super competitive system that all the companies don't own each other, and there is true competition. But to do that, you have to have antitrust.
And not to mention that healthcare is not like any other commodity. It's not something you can just choose that I want to have it or I don't want to have it. And people who think that they don't need
It's not a cell phone.
when the time comes that you do need it and you don't have it, then you're risking your life, you're risking your personal financial health for the rest of your life. So it's not the same as Warren Davidson should make a note of this, a cell phone, for example.
Well, you talk about free market. A while back, I was talking to my HR manager. I've got insurance through my employer, so I'm not on the ACA. But we were talking about it, and she mentioned that she was opposed to it because she thought competition was good. And I'm thinking, you're competing for the healthcare, not me. Give me options that I can compete and have my say. I don't have.
We don't even know how much anything costs.
Yeah.
Until the ACA came along, there wasn't even any way to compare compare prices between doctors and hospitals and different medications.
Yeah, and I've got great health care, you know, if you forget about the $10,000 deductible.
Right. Sure. Right.
But
Yeah,
on top of it too, you know, we wouldn't, if you had the single payer, we wouldn't have that issue we got right now between Premier and United Healthcare, where they can't agree on the prices. So if you have United Healthcare, you may have to find new doctors.
Yeah.
You won't have that in Canada and other industrialized countries.
And in my health care, like I said, I've got the $10,000 deductible. My company does put a little bit into an HSA, about $3,000 a year. I'm 60 years old. When I'm 65, I'm cut off because the idea is I go to Medicare. But now I go to Medicare, I'm changing insurance. There's the pre-existing conditions, arthritis, prostate issues, and high blood pressure.
It doesn't count, pre-existing doesn't count for Medicare when you first go in.
We'll look at 5
After
years.
you're in it, then.
Okay. Well,
Because I'm in it, I'm 71, so.
Yeah, but
5 years.
I wanted to say that I have friends in Australia, I have relatives in the UK. They're all single payer type systems. I don't know how they do that, whether these little companies are given so much by the government to handle or what. But they all work, and I've been on a lot of trips overseas with these people. Oh my gosh, they can go anywhere and get health care on their trips. We can't even do that here. We have to buy insurance to go overseas to be taken care of. But their country covers you wherever you're at. So,
Absolutely. Well,
you
and
know,
then
I don't know how hard that
then
could
the
be.
thing is
That's what real compassionate government
right.
looks like.
Then there's the thing that people who are on ACA now, who will be kicked, or Medicaid expansion. Let's just talk about Medicaid expansion. People who are on Medicaid expansion now, who are treated for illnesses, now have a pre-existing condition. When they're kicked off of Medicaid expansion, guess what's going to happen to them?
They're gonna have a gap.
So now there's this high risk pool
Many of those children.
that are not going to be covered, or if they're going to be covered again, it's going to cost them an arm and a leg, which is just going to bankrupt the middle class.
I had a doctor tell me that if you are a new Medicaid patient, you have a hard time finding a doctor.
Oh, it's very true.
Oh, absolutely.
It's hard to find a doctor anywhere with care service.
Right, and so a lot of times federally qualified health centers take over. In like Clark County or Rocky Horse, you know, we get a lot of the Medicaid patients because obviously, you know, we're a federally qualified health center. So, and that's another thing that goes on this bill is Planned Parenthood is going to be defunded. So what happens to these people who cannot go get birth control or cannot go get simple women's health issues? The fact is they try to talk about how there's 20 to 1 federally qualified health centers in the nation. In Ohio, this is not true. In Clark County, it's not true. There's one. There's one Planned Parenthood and one federally qualified health center. That's not a 20 to 1 ratio. It's just not true. These facts are not accurate, or they're alternate facts, as Kellyanne would like to say. But it's true that this president ran on a platform that he was going to help the blue collar families. He was going to help the middle class. And what does this bill do? It decimates it.
Everything he's done has hurt the middle class so far. They haven't realized it yet.
Well,
And
Warren Davidson.
it's not even us. What happens when we all can't pay for our insurance when we have to go to ER? We have to go by squad. You know what? They're going to be stuck with bills of precinct squads.
And they're not going to be getting
run,
reimbursed.
and the hospitals can't afford to run. And the government's going to have to bail those people out.
Yeah, because ambulances bill your insurer, and if they can't bill an insurer because you don't have insurance, taxpayers have to pay it.
Or
And so it's
not
this.
going to cover emergency care.
Right. It's a very vicious circle.
And
I've got a
Warren
little story
Davidson.
for you. My wife and I were in Bolivia last year, and she passed out 3 times. And the tour director took her to the hospital. And she was in the hospital for a day and a half. She had blood tests, she had chest x-ray, she had EKG, she had a brain scan. She had 4 different doctors. She had a private room, a nurse in there the whole time she was in there. And you would not believe what her bill was.
For what?
$2,600. way overpriced here.
Yeah.
Right. I don't
Which
think
goes back to
people
the
understand.
antitrust.
I'm sorry.
No, go ahead.
I don't think people understand the link between healthcare costs and bankruptcy. I've been reading little bits online. I can't quote you numbers or anything, but when the ACA came in, bankruptcy rates went down. There's a perception that people who are in bankruptcy are just, lazy people who haven't kept up with their bills. When a lot of there's a real large percentage of people in bankruptcy because they're head over heels in debt with medical bills that they can't afford. Yeah, and that could be any of us. So that is going to be a real problem for all of us as well.
Well, people make the decision to stop getting cancer treatment based on the cost. People
Right.
choose to die rather than allow any more debt to rack up for their families when they're
Right.
gone. People literally choose to die rather than keep getting care that they can't afford.
And then people in Pennsylvania, I don't know if you know this, but their families are responsible for their
Yes.
loved ones' medical debts when they die.
Yes.
That's generational bankruptcy.
Well, and Lindsay spoke about how, it was just poor life decisions. That's the reason why you have pre-existing conditions. So we're talking about babies who have heart murmurs and
Right.
babies who have cleft palates and
Asthma.
babies who,
Asthma's so common. Diabetes, so common.
Yeah, absolutely.
Choose to have asthma.
Even if it was a lifestyle issue that caused someone's health problem, I don't see how that eliminates
They should still
Yeah.
be able to
Right.
afford
the
health.
human aspect of just having compassion for other human beings. And those people still need to have care. They're still going to get the care if they have to have it. We're still going to pay for it one way or another, whether it's through our taxes or then through having to subsidize their care in the cost of our own care. So why don't we just let people get the care they need, period? And before it becomes, my mother has gotten insurance through the Medicaid expansion here in Ohio. And she worked her whole life, and she was a victim of the recession. She lost her job in a factory that she had had for about 15 years prior to that. She tried to use the little bit of a payout that they gave to her to start a business, and it was a recession, so it was very hard for her to do that. She lost her home, she lost her business, she had no job. She had to go to providing home health care to other elderly people who did have insurance, but she had none. And so she did backbreaking work, emotionally draining work for very little money with no benefits, no health care, and she did not see a doctor for years. And I would beg her, and she would have these symptoms, and I would say, please go to the doctor. And she would say, I'd rather die than go into debt. And so she didn't go. And now that she has care, and she has stage 4 lung cancer, they want to take that insurance away from her, right when she needs it the most. So, she's at the point now, if they're gonna roll this back and take it away within 2 years, she would rather die. Hopefully I won't be around in 2 years so that I don't continue to rack up debt. This is supposed to be compassion.
well, and our own congressman told a mother at the Springfield town hall, just go get another job.
You need to get a better
Yeah,
job.
and he says your neighbors don't deserve to pay for your
They're not
health care.
entitled, which is another misuse
They're
of
not
the word.
entitled. Yeah, he loves to use these words. Your neighbors are not entitled to pay for your health care, So I guess you should be a good neighbor and just die already.
This mentality, this
Another
go ahead.
bill before the Ohio Senate, and it's switching. Your doctor prescribes medicine A. The health insurance company, usually based on money, will say no. We'll try drug B.
Yeah.
So drug B may not work, or drug B could actually harm your health. So this doctor has proposed this bill, and I can't remember the number of the bill, but to at least make it easier to contest the decisions of the healthcare company. If he thinks drug A, and who knows your health better than your doctor? Not some administrators sitting up in Columbus or wherever they may be. So that's another bill that everybody should be interested in.
I mean, it all goes back to the mentality of this congressman and the mentality of the Republicans in Congress. Everybody can just pull themselves up by their bootstraps and go get another job and make more money so they can afford health care. It's just not the reality anymore.
And he had the gall to complain about his health care while he was at the Springfield Town Hall. He has the same health care we do, he said. He has the same health care we do through the ACA.
Yeah.
However, he makes how much more thousands of dollars a year to be able to afford it, and then doesn't even have to stand by the ACHA and go through their plan.
And then the
Even
new
though they're-
plan exempts them.
Even though they're exempt from the pre-existing condition.
Yeah.
So it's the same, but it's very much not because you can afford it.
Yeah.
Plus, in the town hall, he also talked about people getting a cheap policy, and he compared it to a cell phone.
Yes.
He said, if you don't want a fancy
Twice.
smartphone, just get a flip phone. And he compared that to a cheap policy. But
So
I
making
think
that choice, to have coverage that really covers nothing, it's just the same as
let's
choosing to have a
let's
flip
look
phone.
at let's look at a cell phone plan. So we're talking, cell phone plan has X number of minutes, X number of minutes, X number of minutes, X number of text messages, X number of text. They have different levels. So when we put that analogy to work, it means prenatal care, it means OBGYN, it means emergency services, it means
Ambulance rides.
dental, it means vision, it means all these things like that. If we want to talk about that analogy, which one do you exclude from your plan? All of them are necessary. So it just doesn't make sense. Like the whole, and it just talks about his mentality. He's out of touch. He sits in his mansion here in Troy and thinks that he is just so above the middle class and so above the poor in America that it's ridiculous.
And he
well, and
thinks
the
that
AHCA says that it will not cover basic services. So, an analogy, that cheap plan, you can buy it, you can spend your money on that cheap plan, but the problem with that is when you get sick or you get in a car accident and you have that cheap plan, you're going to find out that that cheap plan does not cover any or all or most of the services you need, and that by purchasing that cheap plan, you've just wasted your money.
Right.
Or you can buy into the high risk plan, which now they're trying to say they're going to throw $8 billion into it. It's,
The last I
all
heard,
the studies show that if every study that's come out that I've seen is that they would have to throw almost $25 billion into it a year, and this is $8 billion over 5 years. Like, so this high risk plan is just going to collapse the moment it hits line, and that's just the fact.
now they're saying 110 billion over 10 years.
The Center
110
for,
billions over 10
the
years.
Center for American Progress says the AHCA, i.e. Trump Care, is already underfunded by $200 billion. That is $20 billion underfunded per year over 10 years. And yes, Brad, you were right. They said that it would take $25 billion per year at the least to fully fund those pre-existing condition high-risk pools. So does that sound like guaranteed care to you?
And even if the bill was currently paid for as is, 24 million people are still going to lose their health care. Even if they have enough money at this point to pay for it, that millions of people will still lose their health care. And that will only grow.
We haven't even talked about what they're going to do with the money they save.
well, it's a tax cut.
It's a tax cut for who?
For rich people.
The rich people, the wealthiest people.
$100,000 and over, isn't it? $250,000.
200,000 and over, and
Yeah.
250,000 for a couple.
Yeah.
I first, and I have to. I've got another meeting to go to, but I want to thank all of you for coming out here today. Some of you may know me, some of you may not. I'm Dave Fisher, I'm the chairman of the Miami County Democratic Party here in Miami County. We need to look at this, and this statement rings true. Tip O'Neill said, "All politics begin locally."
Yes.
All
Amen.
politics begin locally. We need, as this group, we're all on the same page here. This bill that passed on Thursday is terrible for a lot of people, 24 million people to be exact. All of us need to contact 5 individuals and tell them how bad this is. I mean, we're all on the same page here. Not only do we need to talk to your friends, your neighbors, your family members, talk to your local politicians. Talk to your school board members. Talk to your township trustees. Talk to your city leaders. and ask them where they stand on this. If they don't stand on the right side of this, say, hey, we can vote you out. And I know what they're going to tell you because I've heard it before, but that doesn't affect me. I don't act on this. Well, I tell you what, most of the elected officials in this town are friends with Warren Davidson. Most of the township trustees, because he was a Concord Township trustee before he ran for office, they are his friends. They are elected officials in Miami County. Get on the telephone. Call your county commissioners, call your auditors. And they're going to tell you, we don't act on this. Oh yeah, you should do. Stand up for what's right. Stand up for what's right for America. And the other thing is, we need to find someone to run against this man. We need to find someone to run against this man. I know it's a tough district. It's been gerrymandered, and I heard someone talk about gerrymandering. That is a big key to what is happening today, is gerrymandering. Okay? We need to find someone to run against him. Also, another person that's going to be also running in 2018, and a very good friend of Miami County, a very good friend of mine, and that's Sherrod Brown. Yeah. Sherrod Brown's Senate race is the most important thing going on in the state of Ohio. He is our only voice that we have in Washington. So when it comes time and things start moving around, things start percolating here on this next election, remember Sherrod Brown, start working for him. I'm actively trying to find someone to run against Warren Davidson. We'll do what we can do. I'll leave my phone number with one of these fine people here. And again, thank you both for putting this on. And
make sure you're selective in who you get.
I'm a firm believer that we need a little more. We need to look at folks' background. We need to know where they stand immediately before we decide to start supporting them.
Yep, absolutely.
We've got to see if they've got a personality that's going to compete against his. That's the
Warren Davidson's an empty hat.
He is. He stands up there, he sweats, he gets super uncomfortable.
Mr. Folk that ran against him last year was absolutely a great candidate. Again, this is a tough district. It's very gerrymandered. It's very, very gerrymandered. So.
Well, the other point is if Republican is more moderate, then we need to support them. If it's going to go Republican, then we got to get the right one.
Warren Davidson received a lot of money from the Koch brothers.
Yeah, it works. $1 million.
It works. And he no more than got elected in the special election last summer, and he ran right over to Jim Jordan in Champaign County. He said, Jim, I want to come on board with you, pal.
Yeah.
Really? Okay.
70% of Warren Davidson's donations come from out of the state.
Absolutely. So, again, thank you all for doing this. The sun is finally out after a lot of days. Maybe that's a good sign for us, but keep working. I said, call your local representatives, your local people. Get people along. The next time we do something like this, the next thing you know, we'll have Prouty Plaza full. So, again, I have to go. Thank you all. And everybody have a good weekend.
Thank you. So we're at the point now where we're kind of going to do the die-in. So if anybody would like, do we want to participate in the die-in, or do we think we're good?
I think it would mostly be for our own benefit at this point. So
I think we're fine.
I don't think we all
Would
want
anybody like to march past his office and just shout something at him?
I'd like to say a couple of things.
Yeah.
One is that if you don't already know, there is a single payer bill in the House of Representatives, House HR 676, that has 108 co-sponsors already. I think it was introduced by John Conyers, I believe, and basically it's Medicaid for All Act. It was reintroduced in January 24th. Also, I'm with Move to Amend, and two things that we're working on that relates directly to healthcare is we think corporate personhood should be abolished, and that campaign spending should be regulated at all levels of government. So I just wanted to throw that out there. I have a petition if anybody wants to sign a petition, but anyway, remember that there's this one. There's already something there. Of course, I know Bernie Sanders is supposed to be introducing something in the Senate, so on single payer.
So the next step really is still holding Warren Davidson accountable, but then we have to work on Rob Portman, who has said that that he would not support a bill as long if it, especially in its current format.
Due to the mental health issues like flashes and substance abuse flashes.
And it wouldn't cover as many people as currently.
Yeah.
So we need to hold him to those words. We need to demand that he vote the way that we want him to vote. And if he chooses not to, we'll just remind him in 5 years he's up for re-election. And you know, Ohio's a purple state, so.
There's something on Facebook. Again, I know just little bits and pieces on it, just enough to be dangerous. But there's a rally against Portman at the Golden Lamb, which his family owns. The issue is health care. I can't remember what date it is, but I saw it on Facebook. Is it? I knew one in Lebanon. I wasn't sure where
If you're not connected, then get connected. If you are, just keep up with our emails and our Facebooks and our other forms of communication. Lunch now, so if you guys would like to join us, we would love to have you. Thank you guys so much for coming.
Thank you so much.